Assalamu alaikum wa rahmatullahi wa barakatuh, guys. Welcome back to our podcast, Kentucky New American Media. Today, I have a special guest, Ben Goldman, right? Benjamin Goldman or Ben, is it okay? So Ben, please tell us yourself, who is Ben and
Sure.
what you do.
So I'm Ben Goldman. I work at Louisville Metro Public Health and Wellness in our behavioral health equity team. That team, our focus really is identifying some of the inequities and gaps we see in our community around health outcomes that have to do something with substance use or mental health or both, and then working with the community to try to address those gaps or inequities that we see.
And how long have you been with the Louisville Metro Public Health?
I just completed my 6th year with the department, and I've worked the whole time either on substance use and mental health stuff or COVID stuff, or both at the same time.
At the same time. Wow. I know you for a while, probably 4 years.
Yeah.
And, I learn a lot from you. So thank you for that as well. And so, Ben, you do, mostly, as you said, mental health, substance abuse, and also, being the equity, helping folks, also immigrants and refugees in Louisville. So tell us how your job, what you do, can help us, our communities.
Absolutely. So a lot of the work we do is called population health. So we're really looking at trends in the community, which populations are being most impacted by which issues. What are we seeing? Are more people dying of a disease or a negative health consequence this year than last year? And so a lot of that translates to just trying to communicate that back to the community. So anytime that I have a platform like this, I like to talk about the drug supply. Our drug supply in Louisville is unregulated, right? The illegal drug market.
Okay.
Nobody is inspecting those drugs. Nobody is, it's not like when you go to the pharmacy and you can be guaranteed what you're buying at a pharmacy has been through rigorous, health, standards and purity testing and all of that. The things that people are buying, on our streets and on the dark web, all of those are just a random assortment of what they claim to be, inert substances, harmless substances that are added in, but increasingly synthetic opioids. And this is what we talk about when we say things like fentanyl or carfentanil. These are very, very strong drugs that are driving the overdose crisis that we're seeing in our community.
Wow. So in our immigrant communities, there is a stigma when it comes to overdose. We don't even want to talk about it. And just in Louisville, what are the numbers you see annually people die on overdose?
Sure. So last year we lost around 500 residents to fatal overdoses.
Wow.
And the vast majority of those were a synthetic opioid like fentanyl. Now I want to be clear.
Yes.
Just because fentanyl is the substance that's responsible for killing the person, in many cases the person didn't know that there was fentanyl in the substance they purchased. So to give you an example, when I was in high school, when I was in college, students all around me were using prescription pills, and they often had not been prescribed as prescription pills.
Yes.
They were buying a Percocet at a party and oxycodone on the street, and they were using those, and for the most part, those drugs were pharmaceutical grade. Somebody had procured them, somebody got them at a pharmacy, and they were diverting that supply. What's radically different now is regulation and enforcement has really closed down that pathway of accessing those pharmaceutical drugs.
Yes.
And what's filled that vacuum is counterfeit pills. So the same as someone might buy a watch that looks like a Rolex, and it turns out it's fake.
Yes.
More than 70% of the pills being sold not at a pharmacy, right? So at a party, on the street, through a website that's not a, official pharmacy. Those are tainted with synthetic opioids. So people are taking what they think is a Xanax, what they think is a Percocet, what they think is an OxyContin, and what they're actually getting is an incredibly high dose opioid, that's leading to their death. So I think your point about stigma is really an important point. that we want to highlight, stigma is never helpful for substance use. But I think that when you contextualize it in terms of a drug supply that's not safe, it takes a lot of the blame or the sort of the judgment, in my mind, away from the individual and really starts to shift it to the system, right? People make choices based off of the choices they have available to them. If my friends growing up, if they were getting drugs in the drug supply that we see now, most of them would be dead, right? Wow. They weren't checking their drugs to see what they had in them. They were taking any pill they could get their hands